Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Cardiovascular disease. Women face a treatment disparity despite progress. Women across the globe are still missing out on vital treatment for the number one killer, cardiovascular disease, despite significant progress in the medical management of heart disease and stroke, concludes a consensus statement published online in the journal Heart. Conventional cardiovascular disease risk factors such as high blood pressure and high cholesterol are often not treated as promptly or as appropriately as they are in men, despite accounting for around half of the preventable cardiovascular disease death, says the statement. Healthcare professionals and the public mistakenly believe that women's risk of cardiovascular disease is lower than men's, says the statement. Myths and unconscious biases within clinical practices and societal perceptions further obscure the reality that heart disease does not discriminate by sex, it says. And all too often, women's voices are unheard and their heart symptoms aren't taken seriously enough, it adds. The statement sets out a series of actions for clinicians and their professional bodies in each of the major cardiovascular disease areas. These include raising awareness of traditional and women-specific risk factors for all types of cardiovascular disease, ensuring that women are included in cardiovascular disease research, adverse pregnancy outcomes more likely for those with adolescent prediabetes. A new research conducted at Columbia Mailman School of Public Health and Mount Sinai School of Medicine shows a link between prediabetes among young people and adverse pregnancy outcomes later in life. The findings could alter how doctors routinely screen or counsel youth on blood glucose levels and subsequently minimize potential maternal and neonatal risks. The results are published in JAMA Network Open. This study is an important step in tying life course cardiometabolic health to optimal pregnancy outcomes, said Teresa Janovic, PhD, Associate Professor of Epidemiology at Columbia University Mailman School of Public Health and Senior Author. The findings point to an opportunity to invest in adolescent health to promote healthy pregnancies. In their new study, the researchers examined the significance of prediabetes prior to conception among adolescents and young adults, a group that is more at risk of unplanned pregnancy and least likely to benefit from preconception health counseling. Mental health of children and teenagers may improve using specially designed video games. In a review of previous studies, a Johns Hopkins Children's Center team concludes that some video games created as mental health interventions can be helpful, if modest, tools in improving the mental well-being of children and teens with anxiety, depression, and ADHD. A report on the review of studies, we found literature that suggests that even doubling the number of pediatric mental health providers still wouldn't meet the needs, says Barry Bryant, MD, a resident in the Department of Psychiatry and Behavioral Sciences in the Johns Hopkins University School of Medicine and first author of the new study. In a bid to determine if so-called gamified digital mental health interventions or video games designed to treat mental health conditions benefited those with anxiety, depression, and ADHD, the research team analyzed their use in randomized clinical trials for children and adolescents. Bryant and child and adolescent psychologist Joseph McGuire, PhD, identified 27 such trials from the US and around the world. The studies overall included 2911 participants, with about half being boys and half being girls between the ages of 6 and 17 years. The digital mental health interventions varied in content, but were all created with the intent of treating ADHD, depression, and anxiety. All games were conducted on technology platforms such as computers, tablets, video game consoles, and smartphones. The video games are available to users in a variety of ways. Some are available online, while others required access through specific research teams involved in the studies. A complete approach. New recommendations for cardiovascular disease risk management before, during, and after non-cardiac surgery. The 2024 guideline for cardiovascular management of adults undergoing non-cardiac surgery reflects a decade of updates and new evidence since the guidelines last release in 2014. It is published in the American Heart Association's flagship peer-reviewed journal, Circulation, and simultaneously in JACC, the flagship journal of the American College of Cardiology. The recommendations address patient evaluations and assessments, use of cardiovascular testing and screening, and evidence-based management of cardiovascular conditions and risk before, during, and after surgery in those patients. There is a wealth of new evidence about how to best evaluate and manage perioperative cardiovascular risk in patients undergoing non-cardiac surgery, said chair of the guideline writing group, Anna Thompson, MD, MBA, FAHA, a professor of anesthesiology, medicine and population health sciences at Duke University Medical Center in Durham, North Carolina. From prior studies, conditions such as high blood pressure, type 2 diabetes, age older than 55 in men and 65 in women, smoking and obesity are known as risk factors that predispose patients to cardiovascular disease. Others have a family history of premature coronary artery disease, which can also put them at increased risk, Thompson said. This guideline is written with the understanding that these and other cardiovascular risk factors and conditions can contribute to negative surgical outcomes if they are unrecognized or not optimized before surgery. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.